African countries currently procure about 95% of their HIV and AIDS treatment drugs directly from India. Despite government making access to treatment affordable, President Geingob warns that the fact the drugs are imported would have a negative impact on gains made. The only sustainable solution, he says, is increasing the involvement of the domestic private sector. Namibia ranks high among countries making progress in achieving the UN's 90-90 target. New HIV infections have been reduced by 20% since 2010, mother-to-child transmission to under 5%, while government has increased domestic funding by 65%.
Sustainability, yes, 90-90.
Yeah.
We're doing very well.
Yes, I know.
That's lacking down. So sustainability.
Yeah. Yeah.
In Zambezi, we're doing very well because of low of people from Gambia and so on. We are having very good problems. So as you said, if you achieve this level, we must sustain it and move on.
Yeah.
To the right.
UN-AIDS is in the process of finalizing a report on how African countries can maintain the momentum in fighting the epidemic.
I think our problem now, we have a good result, but we need to be able to sustain. Almost 90 to 95%, except your countries, of people who are on treatment based on resources coming from outside of this continent. We are producing only 3% of the medicine we are consuming in this continent. And we have 25% of the burden of the world disease. So we have some practical things we can be able to really pick and say that this is not just rhetorical, let us make everything universe, but how we can move on those issues, practical issues, to make sure that we have a possibility to mobilize private sector, different structure to come and produce first, and two, to make sure that also our resources locally can be mobilized in some way to sustain our gain. If not, it will not be possible. Even if we have to reform, to bring a health reform system which can bring a social insurance scheme for poor people to start to transform progressively and think about long-term investment with return.
Meanwhile, the UN-AIDS Executive Director has appealed to government for the organization to be accredited by Namibia as a development partner. Discussions in this regard will take place with the Ministry of Health and Social Services.